Hello, my name is Tanya Ward and I'm the Simulation Coordinator here at the Center for Clinical Excellence. During your simulations here you will be using a high fidelity mannequin, SimMan3G, and today I want to take the opportunity to point out to you the various unique features so that when you come here for your simulations you'll be comfortable and know how to properly use the mannequin. Assisting me today will be Tara Strawn. She is a simulation nurse here at the center, and you will be interacting with her as well when you're here.
Welcome.
Now, you might have noticed that the simulator's eyes actually blink. The pupils will also react when a light source is shined into the pupil. The nasal and oral airway are functional and will admit a nasal or oral airway device. The pinholes across the forehead, the eyes, ears, nose, and mouth allow for secretions if called for in your simulation. The simulator also has bilateral carotid pulses, and a brachial pulse may be palpated in the upper aspect of the left arm. You may also obtain a manual blood pressure by placing the cuff on the patient's arm and placing your stethoscope at the antecubital fossa. SimMan3G has bilateral palpable radial pulses. To activate the pulse, find the soft spot approximately 2 inches up on the thumb side, press all the way down to activate, and then back off slightly until you feel the pulse. If you press too hard, you will occlude the pulse. The right arm is the IV access arm. You may push IV meds and fluids through this arm. The tube attached to the back of the simulator arm is attached to a collection device under the bed to accept any IV fluids. You'll also notice that the simulator's chest rises and falls with inspiration and expiration. You may auscultate heart sounds anterior, and lung sounds may be auscultated both anterior and posterior in upper and lower fields as well as lateral. So you can hear upper, lower, and lateral. During auscultation, the rise and fall of the chest wall will stop momentarily to allow for assessment of heart and lung sounds. When the chest is not rising or falling, you will not be able to palpate peripheral pulses. SimMan3G may be paced and defibrillated at the access points on the right shoulder and left side, and EKG leads may be attached at bilateral shoulders and lateral sides. You can perform CPR on the simulator, both ventilations and chest compressions. The simulator has convulsion capabilities as well. SimMan3G has vowel sounds in all 4 quadrants, and femoral pulses are palpable in the bilateral groin area. A urinary catheter may be inserted and urinary return can be obtained when the catheter is properly placed. Simulator may have either male or female genitalia based on the simulation that you are being asked to run. Bilateral pedal pulses and posterior tibial pulses are palpable as well. The soft spot is located in the middle of the foot Press down and back off, and the posterior tibial is present in the lower inner aspect. Vital signs may be obtained from the patient monitor located at the bedside. The temperature displays as T peri, and the value is visible on screen at all times. To obtain an oxygen saturation level, place the O2 probe on any finger, either hand, to display the value on the patient monitor. In the event that the patient's O2 sats are below 90%, a blue light will appear in your patient's mouth to show that the patient is cyanotic. When you remove the O2 probe, the O2 sats value will no longer be visible on the monitor. To assess the cardiac rhythm, touch the patient monitor where it says attach ECG leads. The rhythm will appear, and it's showing on our patient monitor now. You can obtain an automatic blood pressure by placing the cuff on the patient's arm and touching the patient monitor screen in the lower left corner. Because the simulators operate wirelessly, we require that all cell phones be turned off as they interfere with operation and could negatively affect your ability to interact with the simulator. Remember to always conduct yourself in a professional manner, just as you would in a live patient's room. Remember also that you are always on audio and video, so everything you say and do is recorded here. If any time you have any questions about the simulator or any unique features, you have any questions at all about SIMSPC, please don't hesitate to ask one of the CCE staff. We welcome you to SIMSPC, and I hope your learning experience is an enjoyable one. Thank you.